light touch. And then I'm going to move the skin only. So when I apply my pressure, my fingers are in complete extension and the arms do the work. My hands are palpating the condition of the skin. How far can it stretch? And I'm directing it in the direction of lymph flow. So where does this drain to? It's draining here, toward the clavicle. So how I apply this technique, slow, rhythmic, with light pressure, and always pressure and release, means that I'm going to have a very profound effect also on the autonomic nervous system. The patient will relax. Of course, it's a little difficult for her because she's lying here in front of all of you. But essentially, you see that we have light and gentle movement. You will notice I'm not applying any pressure, but you can see, perhaps with the camera, that the skin is moving. This pressure is very light and very gentle. Each movement has a pressure phase and a zero phase, meaning that the client doesn't feel the pressure, but my touch is still there. So first we do the neck very completely, very thoroughly. I work the sides of the neck where you saw the picture that had all the diagrams of the lymph nodes in the neck here. And then I'm going to work under the mandible. So my contact is under the bone. I move the skin, and you can see that the skin on the face is being moved, even though I'm not touching the face. And remember, we said a line that goes from the root of the nose to the angle of the jaw. Everything underneath that area is draining here toward the mandible. So I'm making sure that I clear the proximal pathways first. And of course, everything finishes down around the region of the clavicles. I'm not working on the clavicle. I'm going to work lateral to the jugular vein and superior to the clavicle. I will do this treatment with many repetitions. Here I work the nose in front of the ear. It's very light, it's very gentle, very repetitious. I always do 5 in each position, and I will repeat the sequence usually 3 times. Normally, a treatment of the neck and face would take 30 minutes, but you would all fall asleep if you were watching me. So here, do a little bit more, and you can see every once in a while that your client will swallow. This is not unusual because we are moving fluid. When we give our clients a treatment, we always have to tell them, please drink lots of water before you come for your treatment. I will also work the area over the shoulders and very light pressure, but big movement of skin. If I increase the repetitions, there will be even a more relaxing effect. And I make sure that I work skin over the muscles. I'm moving just the skin, not the muscles. And I complete my treatment of the neck just the same way that I started it. Working over the sternocleidomastoid muscle, I move the skin 5 times in each circle that releases toward the largest of the muscles in the body here. The treatment of the neck takes usually about 7 to 10 minutes. Then we move to the face. For the face, we introduce our touch with a light effleurage. I'm going to use flat finger contact for stationary circles. Again, my hands are sitting very lightly on the skin. The arms are doing the work, and you can see her lips are moving gently here because the skin is being moved. There is no pressure. The arms do the work. And I would repeat the sequence here 3 times. Then I would go to the upper lip. So this is all in the direction of lymph flow. And here, very clearly, you can see I'm working the skin at the corners of the mouth. You see the lips moving. She's smiling gently here. And this is because she is relaxed and my hands are moving the skin only. I'll repeat the sequence 3 times. Then I'm going to remind the drainage. It has to go down to the neck. So I will treat the neck. I don't have as much contact as when I was working on the neck from standing at the side of the table. Big movement of skin. We work on the nose. Here, my hands are going to maximize the small contact I have with my 1 finger here. The long finger is in contact. You can see the skin is moving on the nose, but the nostrils are not squeezed shut. She can breathe. It's a good thing. And I'm going to cover the nose completely. The drainage for the nose from the midline is going to go down toward the cheek area, which we've already worked on. So I'm going to encourage the nose to drain in this direction as well. Covering all of the skin on the nose. I think your cameraman does excellent work. He's able to show a lot of things here. And we see the skin is moving, but it's very light. Very little movement around the nostrils. And then I'm going to encourage the drainage down toward the direction of lymph flow, which we said for this part of the face is going to go underneath the mandible. So here you will see the arms do the work. There's no fingers wiggling. There's no pressure. I'm not pressing into the tissue. I'm sitting on the skin, and the arms do the work. The hands are relaxed, and the movement of skin is very gentle. Always in the same direction. And then I'm going to move the skin here and encourage it to drain toward the neck. And I'll do that many times. Then only then will I work on the eyes. So you will notice I did the neck, I did the lower part of the face first, and then I will approach the eyes. With manual lymph drainage, we never treat just the eyes. Even if it's the eyes that you're concerned about, the client is coming in because the eyes are puffy or tired, maybe they've been to a wedding or a funeral, and you want to make sure that you do the eyes, but we never do only the eyes. We do the rest of the face first. And then we encourage the drainage here. So we said that in this region, everything is draining till it comes around the ears. So now, I'm going to encourage that movement. You will see the skin on the forehead, the way the eyebrows are moving. It's releasing laterally toward the drainage area of around the ears. It's light, it's gentle work, and we do the same thing here. If you were to ask your client, how does it feel, they would say, well, I feel pressure and then a release, a complete zero. So, we drain everything toward the ears, and then we're going to continue working on the sides of the head here, and pay special attention. I would like you to notice here, I'm working on the zygomatic arch at the sides of the head, and now you can see that the eyes are influenced with this movement. So just working this area alone will make your drainage for the eyes much better. And then we finish with the neck. So the treatment, we said normally for neck and face, it takes about half an hour, 10 minutes for the neck and 20 minutes for the face. If we do other areas of the body, we have a prescribed technique. I would like you to hold your hand out in front of you with your fingers straight and touch your knuckles on the back here.